This was home for 89-year-old Margarita Sam. It was a place the Alzheimer's patient's family trusted, expecting their loved one was getting the care she desperately needed. But on the cold morning of February 3rd of this year, Margarita was found half clothed, frozen to death on a bench outside of the Union Printers nursing home. According to her family, the facility never even notified them. The family found out about her passing days later when the coroner called. Margarita's death led to the state shutting down Union Printers home a week later, and 3 staff members were charged in connection with her death. A 13 Investigates analysis of state data found 17 citations issued to Union Printers home while it was in operation were for repeat violations. But it took an Alzheimer's patient freezing to death for significant action, despite a history of repeated violations and even other questionable deaths at the same nursing home, according to lawsuits.
To keep vulnerable people safe.
Randy Kirkendall, the leader of the agency that regulates nursing homes in Colorado, says enforcement like a shutdown is rare.
That's the first time that's happened here in Colorado in a little over a decade.
State regulators say a progressive discipline system is used for nursing home enforcement in Colorado. When nursing homes are cited, they have 10 days to submit plans of correction, and inspectors follow up at some point after that date. Penalties for serious violations can result in federal fines or outside consultants and management coming into the home to help get the facility on track. In the last 3 years, Colorado nursing homes were fined more than $7 million, or over $7,000 a day, according to state regulators. But 13 Investigates found that enforcement system is not stopping nursing homes from repeating the same violations over and over and over again.
The repeat violations are problematic. I mean, that is not a new issue in terms of health facility oversight. You want to see folks get better and then stay better.
13 Investigates pushed the state for answers on what they were doing about the repeat violation problem. What are we doing to address that?
You know, obviously Chelsea, we track those as well, and we know what the repeats are. Without having looked into those particular facilities right now, I would expect that they are all on some level of discipline measure, probably even today.
Since 2015, data shows more than 30% of citations at the top violating facilities, including nursing homes in Castle Rock, Aurora, Fort Collins, and Pueblo, were for repeat offenses, including failing to protect residents from abuse or neglect, medical errors, and inadequate care. State regulators say they disciplined 2 of those homes in question by requiring temporary management to take over since 2019. We were told those facilities are closely watched, but state health leaders admit it's not the main priority of regulators right now.
Now, obviously, our focus has changed since March. We've been directed to really by CMS and by the governor's office to focus around COVID and infection control and stopping the spread in our facility.
You can see over and over that the same damn thing is happening and nothing really is being done.
Denver-based attorney John Holland has been suing nursing homes since the 70s. One of Holland's most notable cases resulted in the U.S. Secretary of Health and Human Services implementing the current resident-focused nursing home inspection system across the country.
Sad truth about it is the regulatory system does not do its part to disincentivize poor care. It allows you to make up plans of correction that are basically paper mache and put in systems that we don't monitor but once a year after you get past the hassle period of having the plan of correction. And then when they come back, they go, oh, golly gee, you did it again.
Holland believes regulators need to use more aggressive enforcement tactics like taking licenses, putting homes in receivership, and stopping patient admissions to prevent the suffering of our elderly loved ones and possibly their deaths. Any action will come too late for Margarita Sam's family, but they still hold on to hope for other families.
A lot of frail, vulnerable, multiple diseased people, but they're still in their spirits. They're still present. They still live there. They still care. They still love. They still have needs. And they don't need to be rudely treated, and they need people to have time for them.
We've created an online database with all of the nursing homes in Colorado and the number of citations they've received since 2015. That's where you'll find the nursing home with the most violations in the state. It's on KRDO.com right now. Chelsea Brensel, 13 Investigates.